Welcome to the Dogtor Bros, where we have an honest discussion around vet life, both in and out of the clinic. My name is Adam. I'm your dog of the day and your guide through this episode. I'm a relief veterinarian in Louisville, Kentucky, and I'm here with my closest friends from vet school.
Hey, this is Chris. I'm a GP in Winston-Salem, North Carolina.
Hey, this is Brandon. I'm a small animal internal medicine specialist in Fort Collins, Colorado.
Hey, this is Jeff. I'm a veterinary dermatologist in Louisville, Kentucky.
And again, this is Adam. I'm a relief veterinarian in Louisville, Kentucky, as I had stated. And in today's episode, we're going to be diving in, talking about kind of a hot topic in veterinary medicine, that of obesity and overweight pets. But before we get started, we're going to open with one of our fun little games that we do on each episode. So this is going to be a little game of Name That Animal. So I will play you a little audio clip from a specific type of animal, and you guys give me your best guess as to what it is. You guys ready?
Yeah.
Let's do it.
Woo!
All right, here we go. Here's your first one.
Oh, gosh. Pterodactyl.
This is Jeff. That is clearly a velociraptor.
Oh, I know what this is. This is Brandon. That's a fractious cat.
Those are all good guesses, but all incorrect. That was a kiwi, which is a flightless bird found most commonly in New Zealand. I learned about a kiwi watching Bluey with my kids. So,
does it sound like that on Bluey?
I just kind of talked about the color of it. They didn't really play the noise.
It sounds like it needs medical attention.
And honestly, I don't know a lot about a lot of these animals. This was a quick search for some unique sounding animals. So you're all 0 for 1. So we'll hop in with the next one here. All right. So
Alrighty.
Here we go.
A mockingbird.
Okay.
So that's that sound when I don't put the battery in my fire alarm. It needs a 9-volt.
You sure that's not a dump truck just backing up?
Good answer.
That was a marmot. A marmot.
Oh,
wow. Those are actually
That's in
here.
Brandon's
I don't even know what they sound like.
Well, there you go. Now you can go listening for some marmots.
I've heard you had to cover your cars
trivia with your friends
in like tarp material so they don't eat your undercarriage when you're hiking.
Not the undercarriage.
Because the marmots are like messing up all like the wiring underneath the car or something.
Yeah, I don't know about that one, but I believe it.
Nasty little creatures.
They're kind of cute.
They are kind of cute. They are. All right, here's the next one.
so you know when you don't have enough gas in your chainsaw, you're just kind of chinka chinka. That's what that is.
That's what I was gonna say.
Like
I am serious.
I was going to guess gear, like shifting gears, and you can't get it into gear.
You guys are all so close. Even though you know it's an animal, still nobody gets an actual animal. That's great.
Elephant.
Certain I'm close. Elephant?
Elephant is... It kind of sounded like an elephant. No, it was a king penguin, actually.
Wow.
A king penguin, yeah.
Is it okay?
It seemed to be thriving in the video and the little clip that I saw. So yeah.
Okay, good.
All right, we got one more. This is our last one right here, okay?
Okay.
And this one may sound familiar because we did a little audio test before we started.
So that sounds like Adam when he's trying to get his kids to eat something, and he's coming in hot with the mashed potatoes. Am I close?
That probably, my kids would probably agree with you. Yes, probably so.
I think it'll help.
I'm going to go with some type of frog.
Chris mentioned this one earlier, but it's I'm pretty sure that was Sasquatch.
Chupacabra.
Don't you think we would have found it by now if he was making that noise out there?
They only have the audio recording. That's all they have.
Right.
Well, that's true. That's true. That was a sea lion.
What?
That's hilarious. What do you mean?
I vote
so goofy.
we just do an entire episode trying to figure out all the notes.
Just trying to.
Absolutely can fill 30 minutes with that.
That was too good. Too good. Well, you all did terrible, but I expected nothing less. So,
First of all.
All right. So diving into today's episode. So again, we're going to be talking about obesity or even just overweight patients and kind of what we see, the frequency of how often we see overweight patients, what could be going on, what we can communicate and recommend for overweight patients. So just kind of starting out, typical day to day, what would you guys say is kind of the average percentage of patients that you see that aren't even just classified as obese, but just overweight in general?
This is Chris. I don't know if I can put an exact percentage on it, but I'd say more so overweight than not. But I don't know. I think it just depends on it goes in trends of what I see as overweight and some that are normal. But I'd say the majority are overweight.
This is Jeff. I'm gonna educated guess say like 50 to 60%. Like definitely more than most.
And this is Brandon. Yeah, I agree. I'd say at least half, if not slightly over half, is my general guesstimate.
Yeah, and I would agree with that. I'd say the majority, not the vast majority, but the majority of patients that I see would be considered overweight, which I kind of asked that question just to kind of show like how big of a deal this is and how big of a thing overweight patients and overweight pets is, and what we see with that, it's a bigger thing than people realize essentially. And, I have a lot of people who their dog or their cat is just slightly overweight, and you communicate with that with them and they're shocked, they're very surprised or taken aback by the fact that their pet is overweight. So, it's a pretty common thing to see overweight cats, dogs, kind of both. So what is so take me through a little bit. So the most common thing that we use to kind of evaluate weight and overall body condition is what we call the body condition score. And I know there's a couple of different ways to do that and kind of scales. So what do you guys typically do when you're doing that assessment, and kind of what scale do you use for your body condition score?
This is Chris. I use it's 1 out of 9. And just figuring out where they fit in the scale, with 4 to 5 being ideal. I usually tell people that 5 is they're good. 4 is that they're just like an athlete and super in shape. That's just how I kind of get them to think about it. And then anything below or above is not normal. The majority are probably, I'd say, coming in are like 6, 7s.
Yeah, this is Brandon. I agree. I use the 1 through 9 scale, with 4 to 5 being pretty normal, 6 being very mildly overweight, but still relatively healthy. And then 7, 8, 9 being significantly more obese. I think it's like a 10% increase with each like point on the scale once you go into the overweight range. So I'd say the majority of the pets that I see are probably in the like 6 to 7 range too, if they are overweight. And I agree with Chris, like 4 out of 9 is considered like just perfect, ideal body condition.
This is Jeff. I also do the 1 out of 9. I would say I'm only slightly different in what I call overweight, because I think 5 out of 9 is pushing it, because I almost hate how we do it. Like, I almost wish it was 1 out of 10, because I feel like 4.5 people split corners with it and write that in their records as like perfect. So I think like 4 out of 9 is where I want most of my patients to be. 5 out of 9 is 5. 5 out of 9 is fine. And then like over that is you're I think most people would call overweight. Most veterinarians would call overweight.
That's funny that you say that, because I also use the 1 out of 9 scale, and this shows that there is some subjectivity to this, because for most like ideal patient, I call them a 5 out of 9. Like, to me, that is my like center, middle of the ground. But like you said, 4.5 is technically that perfect middle. So I feel like you'll see some kind of say 4 out of 9 is perfect. Some will say 5 out of 9 is perfect. I'm kind of like Chris said, like a 5 out of 9 is like a good average where I want them to be. If they're like healthy and athletic and more lean, then I'll typically give them a 4 out of 9. I know some vets will use a 1 out of 5 scale. I don't like that as much, because I like having more options, in terms of how I rank them. But when you guys are kind of doing that assessment, what are you kind of looking for to show that, all right, this may be a 7 versus a 6, or, a 4 versus a 5 even? What kind of landmarks and kind of keys are you looking for to make that assessment?
So this is Brandon again. The nice thing with that scale that we use, there's a pretty standard like expectation for each patient for a variety of factors, including fat covering over areas like the ribs, the back, the tuck of their like from where their chest goes to their abdomen. So I kind of just base it based on the like the scale itself, since it kind of tells us like this expectation of what we should be seeing. And we have obviously a 4 out of 9 bulldog looks different than a 4 out of 9 greyhound, right? So you kind of have to do it by breed. So like a tuck on a greyhound is going to be way more tight than it would be on a bulldog. So you have to take those things into consideration too. But I just really base it on fat covering, on palpation of the back, and then like an overall observation as well. And then palpating that abdomen really well to get a good sense of their tuck, both on palpation and just visually without palpating.
Yeah, and I think that's really important for owners to kind of know where we're coming from with that. And that's why I like kind of going over this. This is obviously a lot of stuff that we know and other vets listening are going to know. But for any potential owners or anybody else out there listening, this is just good client communication and good for them to know. Because, I mean, if somebody gets a piece of paper with the exam notes and it just says BCS 4 out of 9, they don't know what that means. They don't know what they're looking at. So taking the time to explain that and kind of help clients understand that, that's kind of our goal with that, with going over that. So what are some common causes that you guys will see in terms of obesity or even just overweight patients? Because this is kind of more broad than just obesity. Again, just kind of overweight in general. Like, obviously, there's the big ones like feeding too much or, lack of exercise or things like that. And you can dive into that a little bit too, but what are some other things that we'll see or recommendations you may make based on what you're seeing from the exam and noticing that the patient is overweight?
This is Jeff. I can tell you from derm perspective, one thing we were laughing about, or I was laughing about before we started recording, I was like, is this a derm episode at all? Like, where do I even chime in? But I think I kind of have like two thoughts of mine working in specialty practice, which is if a patient is coming to me specifically for like a non-resolving or recurrent pyoderma, and they are also overweight and showing other clinical signs like quote unquote slowing down, or the meds just aren't quite working, of course, I'm going to work them up for the skin, but I'm also potentially going to check their thyroid and a full thyroid panel at that. If they are also, so these are questions I ask in the room too, like if they're having polyphagia, polydipsia, polyuria, eating too much, drinking too much, peeing too much, etc., like those common classical Cushing's type signs, I might potentially ask them or consider workup for Cushing's disease. But if I'm treating allergies and they just happen to be significantly overweight, I often am tagging in or referring them back to the general practitioner to be like a good steward because I want to take care of the skin things. But if I don't think it's directly related, I'm going to say, hey, you might want to touch base with your family vet on options for specifically for weight loss if I don't think it is related, to kind of keep that relationship solid, and also to treat what they're coming to see me to treat. And I kind of wonder, Brandon, like how that works in your land because you see like a different population than me.
Yeah, for me, it's kind of just it's part of my internal medicine like job or specialty to incorporate nutrition, because a lot of the diseases that I manage, whether it be kidney disease or liver disease or what have you, GI disease, like we're talking a lot about different diets that are formulated for those patients with those different conditions. So at the bare minimum, like if we have a patient that's like overweight, I do bring it up with the clients, and if they are interested in hearing more about like what can be done, if there's no like obvious like metabolic cause that I can determine based on blood work that's already been done or clinical signs that are there or are not there, I'll usually calculate a body condition score, or not a body condition score. I'll calculate a RER, just a resting energy requirement. So RER. And based off of that rough estimate, plus there's a couple, like AHA has actually a pretty good, like not a consensus statement, but some guidelines for feeding and like how much you should be feeding a pet. So there's different like factors you can multiply in for different RERs based on the patient's age, activity. So I'll do that, get a rough estimate of their caloric needs per day. And then based on that, I can give them kind of a range of calories that they need to take in. And I'll go back and look at whatever food they're feeding, because we get a diet history on their intake history. And I'll just look up the food if I don't know it already and say, okay, well, a cup of this is this many calories. And, you should be having, your dog should, or cat should be having this many calories during the day. And if there's a pretty immediate discrepancy there, that's a simple thing to just talk about and adjust. So if a pet's like already getting too much food, I'll just say, okay, like we have an easy thing to work with here. We don't want to cold turkey, cut them back to like half of their diet per day, but we want to like slowly wean them down to, the appropriate calorie intake. And that goes a long way. I think weight loss takes a long time. So it's something that, I just remind clients, like, it's not going to change overnight. But I feel like that's a really simple thing to do for those pets that are in that like 6-7 range with no obvious metabolic disease that could be causing it. Just have that conversation, and a GPs can do the same thing as well.
This is Chris. I mean, we pretty much do what Brandon says. We'll figure out how much to feed them. Sometimes I've even simplified it even more and just ask them how much they're feeding now. A lot of times I refer to what the bag says on the food. And if they're not doing that, then I say, or ask them like what the biggest issue I see a lot is too, is like I give them a cup, but their cup is like a big gulp. And so, I give them 3 cups, and it's like, well, that's like, I don't know how many ounces that is, but it's way more than what they need. So here's like, I'll give them an actual cup from, whether Purina or Hills, whoever's giving us like free cups, I'll give them a cup. So I will actually have an actual measuring cup and then tell them what to feed. And then a lot of times I'll just keep it simple, be like, oh, how much are you feeding? Like, oh, we're feeding 3 cups a day. I'm like, all right, well, let's cut it back to 2.5 cups or 2 3/4 and see how they do with that. And then if it changes, great. If not, we can always figure out some more. And majority of the time that works, just cutting back just a little bit.
Yeah, I like that you brought that up with the measuring cup stuff, because I have to have the same conversations too. Because every once in a while, a client's like, "Oh yeah, we just like use the solo cup or whatever." And I'm like, not quite the same.
Yeah, that's a really good point, because that's very common to just say, we feed them a cup, and it could be any cup, not an actual measuring cup. So that is very important. Brandon, I'm glad you brought up like the RER and all that, because those formulas are out there to determine resting energy requirements and determine the patient's kilocalories needed for the day. And that information is there, and some clients are very open to that, and they want you to go through all that with them. Some other clients not so much. And they're a little more dismissive of it. With that, I kind of cater how much I dive into it with how responsive the client is. Because especially if they're like a 6 or like a 7, but then they have some other serious condition that they're there for, kind of a pick and choose your battles kind of situation. So if nothing else, what I'll typically recommend is, obviously a good brand of dog food. We did do a whole episode on dog food, so if you need a refresher on that, go back and listen to that. But a good brand of dog food. And then with that, if anything, we want to feed based on ideal weight, not current weight. So if we're overweight, we may want to cut back a little bit, feed by what that bag says on the good quality food, because there are different caloric intakes for different brands and different foods. But again, feeding based on that ideal weight as opposed to current weight.
As far as feeding food, that actually brought something to mind for me. Like if you do have a patient who has allergies, so they're very itchy and you're trying to see if you can get them under control with a good diet, there are some good diets out there that double as useful for diagnosis for food allergy and for losing weight. So off the top of my head, I know Royal Canin HP has a satiety version. I know Hills ZD has a low fat, which is a soy base. Actually, I think both of those are soy based. And I know Rain Nutrition has a kangaroo. So if they have never had kangaroo, that's a good novel protein option for them. They have a low fat version of that too. That's RAYNE, Rain Nutrition. So those are 3 off the top of my head where if you just notice they're overweight and they need a diet trial anyway for at least 8 weeks on a prescription diet, always, those are 3 great options where you can pick off the shelf immediately or even have them order online with a veterinary prescription.
Great advice. Great all-around advice. As we come to the end here, just one last question on topic to kind of round us out here. When it comes to weight management and weight loss, kind of like I'd mentioned, if you got a dog that's a 6 or a 7, that's still something you want to tackle, but you may have a client that may not view it as, a huge concern, but, and again, there may be other things going on, but it's still something we want to address. And you have these conversations with the client. What are some little tidbits that you have or information that you share with the client to help convey the importance of weight management and kind of help with owner compliance when it comes to feeding appropriately?
This is Chris. The big thing we see is overweight dogs start having joint issues. So we say if they're skinnier, they typically do better with their joints. Like labs get osteoarthritis, German Shepherds, we want to keep them skinnier, but it can be any dog really. And another thing they can do at home. So the big thing too, I always see is they have whoever's living with them, whether it's their parents, like elderly parents, or they have young children or whatever, the husband, wife, it doesn't matter who it really is, but someone's always feeding the dog treats or giving them pieces of table scraps. And I always tell the one that's trying to get the dog's weight down, I said, control what you can control. You can't make them stop giving treats. And I said, the dogs are usually going to figure out, and cats, that, hey, they're not getting a treat. And so they're going to be more annoyed about that. So I don't really say stop giving treats as much. I just say cut back on the amount of food for breakfast and dinner that you're giving them. And I said it's going to help out with just decreasing their overall calorie count down. So I said, and I always make this example, is I have kids. I said, we always feed the dogs after we eat, not because we're trying to figure out anything. It's more, or like do anything particular for like a behavioral thing. It's more just so I can gauge like, hey, my dog ate half of my kid's dinner because he threw it on the ground for whatever reason when he was a baby. Like, all right, well, he doesn't eat as much dinner tonight, so I'm going to give him a little bit less. And I kind of just ballpark it, and it keeps him skinnier. I noticed when I didn't do that, he started getting heavier because he was getting half of the kids' meals. So again, you can use that with anybody, but that's how I kind of talk to clients about it.
Hey, this is Brandon. Yeah, I like a lot of what you said. As far as treats are concerned, I don't want to discourage treats either. I'll usually try and steer people towards like lower calorie treats, especially if we talk about treats with their current caloric intake and it's a big chunk of it. So that's definitely a way that we'd go about it. I've also offered for clients to just like come in and weigh their pet periodically in like a month or two after we've talked, just to see if there's been any progress. just to kind of keep them engaged with everything. And then I know we didn't really like dive into some of the different diseases, but like if there's an underlying disease that's contributing to obesity, like hypothyroidism in dogs or Cushing's disease in dogs, those are things that we want to address directly.
And this is Jeff. I'll mention one thing that we hadn't talked about yet, which is I commonly see a lot of diseases on the feet with pododermatitis that are just worsened by excess weight. So some people will call them interdigital cysts. I usually call them interdigital bullae. So blood-filled cysts between toes, common in mastiffs, slabs, some pit bulls, and different things. These overweight animals, how they walk literally is causing their toes to kind of push those tiny little hairs in between their toes, and that exacerbates these areas. And then also allergies is really common as a compounding factor. And I feel like weight loss really helps out a lot of those dogs and can help reduce some medications they're on, because they often are on long-term anti-inflammatories, even if you do food trials and allergy testing. So it just can help all around.
And I'll add too, I should have mentioned like respiratory disease in lots of animals, dogs and cats. It can make a big difference, especially our little friends like our Shih Tzus and Chihuahuas and all these Pomeranians, all these little ones that get tracheal collapse or can get tracheal collapse. Obesity will definitely exacerbate that. Same thing goes for cats with asthma. So there's a variety of things. It's just like obesity can exacerbate underlying problems that are already there.
Thank you once again for joining us on the Dogtor Bros.
If you would like to support us, please share this episode with others who may be interested in today's topic, and leave us a 5-star review on Apple Podcasts, Spotify, or wherever you listen to your podcasts.
Would you like to influence our next episode? We love hearing your opinions and thoughts. Your comments may be our next topic.
Please leave us suggestions via email at thedoctorbros@gmail.com, DM us at thedoctorbros on Instagram, or leave us comments on our posts. Again, this is Brandon. You can reach me at Dr. Mason IM on Instagram.
And this is Chris, and you can reach me on Instagram at dr.chrishernandez.
And this is Jeff. You can find me on Instagram at DermDrJeff, DermDogtorJeff.
And this is Adam. You can reach me on Instagram at DrAdamDVM. That's DrAdamDVM.